Hello, welcome to Schein Chats. We're coming to you live from the ADA in Atlanta, Georgia. I'm Michele Penrose. I'm the Director of Professional Relations with Henry Schein. Today I'm going to be talking about the current and future infection control protocols and really the critical necessity that really the right products, protocols, and implementation of those protocols around infection control are to dental practices. I'm joined here with Dr. John Molinari, who is currently the Director of Infection Control with Dental Advisor. He is a good friend, and he's also a leading authority on infection control for the last 3 decades. So we're really pleased to have Dr. Molinari here to share with us his thoughts and give us some good information around what's current and future in infection control. So welcome, John.
Good seeing you
again,
again,
It's so
Michele.
great to see you,
really
and
good.
Thanks so much for spending some time with us today.
My pleasure.
We look forward to having this chat and sharing some of your great expertise to our viewers around the country.
Okay.
So infection control, as I mentioned, in a dental healthcare setting really requires a lot of commitment and understanding on how to implement the right protocols, products into the dental practice. Can you share with us, John, what are some of the current standards around that and ways in which we can better help dentists and their teams implement these protocols?
Sure. Well, the first thing to remember is everybody thinks infection control and they think OSHA.
Right.
OSHA, Occupational Safety and Health Administration, they get their information about healthcare and risks for healthcare and infection control from the CDC, Centers for Disease Control and Prevention. That is the agency that gathers information about infectious diseases, medical, dental, other health professional groups, and they put all that information together to find out what can be best done to reduce the potential risks for the healthcare professionals. All that information has been gathered. The ADA has used it for years. They've set up protocols and recommendations, and the most comprehensive one came out in 2003 for dentistry, which we still use. 2016, there was a supplement that came out on infection control in dentistry. That really didn't have a whole lot new. It served as an adjunct. It gave some checklists. OSHA takes what they get from the science and clinical science areas, like with the CDC, and then they implement them into regulations. So for example, most states implement the CDC recommendations as their OSHA regulations for infection control. They may add a couple of things, but the CDC is really the science, basic science, clinical science gathering area, and OSHA utilizes that based on the expertise of those experts.
And do you think, it's so important, and I think not only from the health, the team, the healthcare, but patients are aware of this. I know when I go to the dentist, something that's very important to me, in addition to clinical expertise, is, just the overall cleanliness of the practice. And of course, being in the business, I look around. You want to make sure that your dentist is on top of that because it's so important. I mean, This is not an area where you can try to skirt that. And I know when all the new federal regulations came in many, many years ago, a lot of changes were made. I mean, there were slow adopters. But do you feel like dental practitioners have really don't fool around with this these days?
I think dentistry is doing a good job.
Okay.
Are they perfect? Absolutely not.
Right.
Are there areas that they can improve? Yes. You hit a very good point, Michele. One of the things that I talk to people about is patients obviously are coming in for quality dental care.
Right.
But now they're also looking for safe care because of all the information that's in the news about infectious disease outbreaks. They get concerned. And dentistry has been responding for a number of years. I've been involved in this business, for over 50 years. And I've seen the evolution. There are areas for improvement. You see offices cited, for example, for not monitoring sterilizers. Well, it may be that they're monitoring, but they don't keep the records, or they're not monitoring as frequently as they're supposed to. And so they get cited for those things, and that makes the news. You look at failures, for example, in sterilization processing and problems with this. It happens. But when you look at people trying to do the right things, making sure that they change gloves and masks between patients, it's gotten so much better. You and I both remember, probably me more than you, remember when these things first came in, and you had a lot of adaptation going on. Of course, our information often comes from the hospital settings where the risks are greater. So those have been incorporated into the dental recommendations to make sure that people are washing their hands properly.
Right.
I can remember many times in the hospital when I was working with my ID docs and seeing the doctors wash. Dentistry may do that a little bit, but they're much more conscientious. And now, what some practices are doing is they'll even do it in front of the patient.
I see
and
that a lot.
the patients see that.
Yeah.
And that's a plus.
It is a plus.
That's a plus. So areas still need to be addressed. Water lines is a big issue now. The fact that we've had 3 cases in the last 6 years of patient infections with contaminated water is further showing people that they have to improve on things. They may be using certain water systems, but are they complying with them correctly? Are they following the instructions? And you, and with Henry Schein and companies like you, live with this every day. So I think dentistry has responded, is continuing to respond. It's a process.
It always is around compliance and implementation, but I agree with you wholeheartedly. I think overall, for the most part, everyone, their intentions are good. Maybe
Absolutely.
They don't record keep exactly to the crossing all the T's and dotting all the I's, and they know they can get cited for that. But overall, I think, our company, Henry Schein, we do a lot with training, OSHA, and then our field sales consultants, and we work with companies like Hu-Friedy that really, they're on top of their game. They try to help make sure that all dental practices are doing the right thing. And I think, generally speaking, everybody is very cognizant about how important this is, not just for themselves and their team, but their patients. They come in, and patients tend to ask more questions about things like this. So you have to be prepared for that, and you have to know that you're doing the right thing. So that's really good to hear from your perspective, John, that you agree with what we were thinking is happening out there. But I would like you to share with us, why do you think violations may occur?
Why violations occur? One is compliance. People think, I've done it, I don't need to do it as much as they say I need to do it. Right. I hope that's a minority. I think sometimes it's just forgetfulness. People get rushed, people get caught up in things, and they don't realize that patients are looking, even though patients may not be asking questions. But I think compliance is a big thing. The issue with water lines, for example, is people just haven't realized that water could be a problem. I practiced 20, 30 years, never had a problem with water. Well, many of the infections are not symptomatic, they're subclinical. So when something happens that's symptomatic, then it raises the awareness and people start to look at what is really going on, and they see it's much bigger problem. We have an issue now, for example, if you look at compliance with instrument processing, cleaning instruments. Reports have come out of hospitals over the years of dirty instruments, surgical instruments that have been run through the sterilizer because the instrument washer or whoever was cleaning them didn't do all the right things.
Right, missed a step.
And so, and we've seen this in dentistry to a certain extent, not as much, fortunately. But then when you look back, you say, okay, they were doing something wrong in the processing of the instruments. Hand scrubbing isn't nearly as good as an ultrasonic or an instrument washer, of course. So now you have things that are coming out to monitor instrument processing, to make sure things are clean. And there's a number of things available on the market that have come out the last couple of years to check to make sure that cleaning is done properly. Now, the dentists and the staff have to get that information and implement it. So it becomes the responsibility of you, the company, me, the educator, to inform them, but then the ball is in their court.
Right.
It's a process. I think you said that before.
Yeah, it is a process. And I do think, again, we said this, intentions, and I think that everyone's so aware of it. I think that most dental teams really want to do above and beyond. so that there's safety for them and for their patients. So what would you before we close here, what's important to remember when you think about the future of infection control and prevention in the healthcare setting?
That's a good question. I think some people say you have to have written protocols for everything. That's fine. Infection control is so much more than that.
Right.
And I use the word commitment. I always have. The people have to be committed to doing what you said, above and beyond, to protect themselves, protect their patients. And that commitment is literally a mindset. It's not a single occurrence. It's not an occasional doing something that's right, but then not worrying about it. It's an ongoing process. And that's what we try to get in people. That's why offices are asked to have an infection control coordinator if it's possible. That's why when I talk to groups and I talk to the docs, I say, whatever you do, make sure the staff is involved in this, in the discussion, because they're going to be the ones doing a lot of this, and they have to be willing and able to do it. So the mindset and the commitment is throughout the office, not on one dental assistant, not on one dentist, not on one dental hygienist.
The entire team.
The entire team. And I think it's happening. But again, it's a process. Some people think, as long as we write protocols for everything, this is going to... No. The protocols are only on paper.
Yeah.
The people still need to do it. And to me, that's the key.
Yep. That's really, in around everything, it's commitment.
Absolutely.
Protocols are important. We're not minimizing that.
Sure.
But if you've got a book of protocols on the shelf, and not everybody on the entire team is committed to taking the right actions and the commitment and the implementation of all the procedures and the infection control ways in which they should sterilize instruments and clean equipment, and hand washing is still the best, and everybody carries around their little sanitizers. So I think that that's where the rubber always hits the road. Implementation.
Now the protocols, of course, are important because somebody gets audited or somebody comes in from a state board or OSHA. You have to have those types of things. But to me, that's only one part, and the biggest part is with the people.
Well, again, it takes all of us, you out there, continuing to do all the great education around the subject, John, and have for let's just go with 2 decades. And all of our, Henry Schein and our partners here, everybody that's at the ADA.
You guys have been great.
Really just kind of all continue to educate and support our customers and the influencers and the dentists and dental teams. That's the only way we'll continue to get this done.
Exactly.
So thank you so much,
My
John.
pleasure.
I know our viewers, thank you for joining us. This is really an honor and a treat to spend time with one of the leading experts in infection control, Dr. John Molinari. If you'd like to visit henryschein.com, Schein Chats, you can listen to this and share it with your friends and your colleagues. And thank you very much for spending some time with us. Thank you, John, very much. It was great to see you.
Good seeing you. Take care.